You are about to view a 5-minute video of a simulated team meeting. At the end of the tape, you will have 10 minutes to answer 5 questions. Questions will focus on team members' behaviors and the effectiveness of the team in meeting the patient's needs. Please print your answers and do not use abbreviations. 4 members of the healthcare team are assembled for their weekly 8 a.m. meeting. The purpose of this meeting is to develop a plan of action for the clients discussed. Present in the meeting are Andrea Brown, the social worker, Mary Thomas, the nurse practitioner, Simon Wilson, the pharmacist, and Jennifer Rogers, the internist.
It's 8 a.m. Let's get started. Does everyone have a list of the patients we're reviewing today? Okay, the first one is Henry Rosario. Mary?
Sure. Yeah, Mr. Rosario is an 81-year-old white male with adult onset diabetes. He lives alone in a 2-story walk-up. Now, he's unable to control his blood sugar with diet alone, so he takes tolbutamide, 250 milligrams twice a day. He's been taking his medication as prescribed for the past 6 months. So far, he seems to be in good control. His diet's iffy. He has a sweet tooth, and he lives on junk food, despite my repeated instructions about his need to change his eating habits. His eyesight's been declining over the past year. It'll probably continue to decline, but so far he's able to do things like read his medication label, get his key in the door. Basically, he sees well enough to be safe at this time. He'll be coming in for some routine blood work, and I've scheduled a visit with the podiatrist to look at his feet and cut his nails. Yeah, I'm sure he'll be
Well,
fine.
why are we discussing this patient if he's stable? I mean, you know, we all have a lot of work to do and our time is limited. You know, we need to set some ground rules about these meetings if we're going to get anything out of them.
Dr. Rogers, I've listened to your presentations no matter what you choose to focus on. The information I'm presenting is very important. It is exactly what we agreed should be the content of these team meetings. I'm saying he's stable now, but he's likely to be at risk for accidents and hyperglycemia in the future. And since everyone here may see Mr. Rosario over the next few months, I think this presentation is highly relevant.
We're supposed to present cases that seem complicated or require the input of others. Those are the ground rules. Was there something specific about this case you wanted us to review? Should I talk to him about his declining vision or other supports he might need?
Yeah, sure. I'll tell him to contact you when he's here later today.
What about medications? Is there some medications Simon should review?
Yeah, I'm interested in the tolbutamide. Is there anything else he's taking?
He's also taking Tylenol, 650 milligrams for some mild arthritis. And he takes Dalmane, 30 milligrams for sleep. Sometimes he repeats it.
Dalmane? Dalmane is a terrible drug for geriatric patients. He shouldn't be on Dalmane.
Really? Well, he's been on Dalmane for the past 30 years.
He hasn't been a geriatric patient for 30 years,
Well,
has he?
Simon, perhaps you can offer us another suggestion, another medication, a different dosage. You know, sleep problems in the elderly are quite common.
Yes, I know. I'm just surprised you don't know more about sleep medications. I mean, Dalmane can really be a problem because it's got very long half-life, at least 2 days. And this potentiates problems that all the hypnotics bring about, hallucinations, agitation, changes in memory and gait. Now, Benadryl is what I would recommend. Benadryl in small doses, 25 milligrams, can be very effective, doesn't have too many side effects, can be easily. Now, it does have some anticholinergic problems, but we can...
Thanks, Simon. We'll all think very carefully about sleep medications in the future.
Well,
Just trying to...
do we know the history of the sleep problem? I mean, maybe he doesn't need it anymore and he can be tapered off in time. Or perhaps it's sleep apnea that's waking him up?
No, it doesn't sound like sleep apnea to me.
It sounds like you'll work on the sleep problem, but I'm very concerned about his nutrition. It sounds like to me he needs a nutrition consult. I wonder if he can even carry groceries up those 2 flights of stairs.
I've tried to get him to change his eating habits. He's just not compliant. Maybe a nutrition consult will help. Will you go ahead and set it up?
Oh, I have a very busy day today.
Oh, so have I.
But if you can't get to it, I guess I can. Anything else about Mr. Rosario?
Nope.
Good, let's go on to the next patient. Judith Lichtenstein.